Hey guys, Dr. Justin Marcagiani here with Rob Edwards. We're going to be coming to you here today talking about acid reflux and upper left quadrant pain. We'll be unraveling the mystery from a functional medicine biochemical perspective. Excited to dive in. My man Rob, how we doing, brother?
Doing good. Got a great talk in yesterday. I'm excited to
Yeah.
get into this one. Yesterday we talked about, why isn't your functional medicine practitioner working out for you? And today we're getting right back into the A&P of things and breaking things down at a gut level.
Yeah, and let us know if you guys like these fireside chats. We're just trying to have like a conversation. It's not really in an interview format. We're just kind of bouncing things back as if we're sitting around a fire, just talking about a cool topic. So let us know if you guys like it. Appreciate
Yeah, need to have some better jokes during this time, I think, so that
it.
we can
Yeah, exactly. Well, we see acid reflux a lot in practice, right? This is a very common thing that we see. And conventional medicine, hits this pretty standard, right? They're going to recommend it's some kind of pantoprazole, omeprazole, maybe a Nexium. And again, a lot of these medications, by the way, they're now lawsuits where there are studies coming out where they're linked to actually kidney disease, kidney failure. So that's something going to the courts right now. There's some studies supporting that. There's some recalls on that. Also, you're not really getting to the root underlying cause. Because if you're on an acid blocker long term, you're lowering your stomach acid, which means you're raising the pH, right? Remember, low stomach acid means higher pH, right? High stomach acid means low pH. So it's kind of an inverse when we talk about it. And that's going to make it hard for you to, one, disinfect and keep the gut clean because pH matters. pH helps kill microbes. That's why we use white vinegar as a cleaning thing for countertops, or wipe my hot tub side of it down because it gets a little, algae-ish, and I wipe it down with a vinegar because it's not, gonna make a lot of surfactant and bubbles. So it's a great cleaner on all kinds of things. I love it. And so acid is really important for the gut lining from a pH perspective, right? Acid lowers pH. pH then helps knock down microbes, and it activates proteolytic enzymes, especially pepsinogen, in the stomach to start breaking down protein. And a lot of times that lower esophageal sphincter, very important. That's kind of where the esophagus dumps into the stomach. That sphincter tightens up when we have enough acidity. So if we get enough acid in there, that closes that sphincter up. Why is that important? Because it's less likely that we're going to have reflux coming up into the esophagus, either hitting our vocal cords and being more silent, or coming up and really going into the back of our mouth and creating an actual reflux situation. And so it's really important that we have all three of those things addressed.
Yeah, I think absolutely, and this is something that my actually oldest daughter deals a lot with, and that's
Yes.
what I talked to her about doing first and foremost is the acid, because you want that to be able to tighten up, close up, like what Justin's talking about. When that doesn't happen, you're going to have issues. So yeah, we have that's going on with her in this process of trying to get that healed back up again.
Now, her situation, does she have H. pylori?
So we have not gotten that far down in the road yet. So we're in a situation, of course, where she's from another marriage of mine, and so I've got like privy information to it. And her and I have talked about it briefly the other day, but right now she's got more interest in talking about a boy in her life. So that's been secondary to her. Even though I've
It's
told her
not the
that that's
priority.
yeah, I've told her we need to make that a priority. But she's 20 years old, and you gotta play your battle. You gotta fight your battles.
Oh, 100%. So when we look at that, right, I always start with the foundation. So like the first thing is chewing up your food is huge.
Yeah.
Like, you have 32 teeth, about 32 chews or so is where you should be. Does that mean you go in there and like you count it religiously? Oh, maybe initially, just so you get a sense of what it feels like
Yeah.
and just kind of feel what the consistency of the food feels like. Usually like an oatmeal like consistency is where you want to be. Now, what does that do? That allows increased surface area and allows the enzymes and the acids to work better on that food. So chewing is really important. Not overly consuming fluids while eating is important because fluids, right? Water, mineral water, pH of around a 7. Your stomach should be a pH around 2. So that's taking that pH and it's bringing it a lot closer to neutral, right? 1's pure acid, 14's pure alkaline, water's
Mhm.
around the middle, 7-ish, depending on what the minerals in it. And so when you have a whole bunch of 7 in an area where there's less 1 or 2, then you're raising that pH up. So you're lowering the stomach acid. So chewing your food up, doing some good water. And of course, it's dose dependent. I have some patients who are like, oh my gosh, like I can't even get pills down. It's like, well, obviously like 2 ounces of water is like, 6 times less than 12 ounces of water, right? So, an ounce or two to get some pills down is fine. Just don't go into eating trying to hydrate when you're eating.
Yeah, no, that's yeah, two different things there. So, like, obviously, if you're taking a pill form, that's small enough already. You just need to get the pill down. But once that capsule releases, then it's going to do its job. It's already pre-broken down, right? Food is a little bit
Yeah.
of a different story, and I think that's people underestimate what we're doing there. So you do need to chew it down because when your body's trying to take in absorb these vitamins and these nutrients, whether it's from fat, proteins, or carbs, all that stuff has to break down to get it to the cells. And if it's not breaking down properly, right, it's not going to be able to be absorbed, especially in the small intestine.
Yes.
And you're going to have issues. And if you got leaky gut, you'll have more issues because it's going to create an immune response. So,
Bingo. Bingo.
um, so it's an important. That's the first step. It's foundational, but most people sort of just, they think, when they come to see me or when they come to see you, it's almost like people can brush that aside. That's not a big deal. But what we're saying is that that's one of the biggest foundational pieces that we want you to do because that could improve your health by who knows 3%, 4%, 5%, right? Just doing that alone can
Hmm.
give you a percentage increase in the absorption of your cells.
100%. And so, I mean, next big thing. So we're chewing, right? We're avoiding a lot of water. So now there could be gastritis or atrophic gastritis or even Barrett's esophagus, where that lower part of the esophagus, essentially that squamous tissue, which is like more thin, has gotten thicker and it's converted to columnar. Think of it like a callus on the bottom part of your esophagus, and of course that can create dysplasia, metaplasia, and eventually become cancerous.
Mhm.
Become cancer the more inflamed it gets. So we want to calm down that inflammation. So if there's gastritis or atrophic gastritis where that gut lining is irritated and maybe that gut's getting thinner, or in the esophagus area it's getting thicker, right? Not good. So we really want to work on calming that down. And sometimes the acid may be too much. So we always talk about sometimes adding supplemental stomach acid could actually help. And so a good first step is try a teaspoon of vinegar, apple cider vinegar, or a little bit of lemon or lime juice, which is citric acid. Apple cider vinegar is acetic acid. Just
Mhm.
mix it in like an ounce or two of water, like an ounce of water, or do it straight and take it right before you eat or right with your food is totally fine. And start that, see how you feel. If it definitely starts to irritate you or you feel more inflamed, then you want to pause the acid because sometimes that gut lining is so thin and so irritated, even though you need that thing, your tissue is just not ready to accept it. And so we have to draw a line of like, this is what you need, but we need more of an on ramp to get there. It's like, hey, I want to do a CrossFit workout, but I've been sedentary for a decade. I probably need to on ramp for a
Yeah.
few months before I can do anything even close to that, right? And so it's all about on ramping. It's all about periodizing and helping that patient and bridge the gap to help them get where they need to go.
Yeah, and that's just us trying to answer the question of why, right? So, like, why do
Yeah,
you have acid? Why do you have GERD? And if that's the
bingo.
situation, like what Justin's talking about, then we need to hold off because that's your particular situation. That's not everybody's situation, but for a lot of people, that is. And I think that's important to note that if acidity is bothering you, it does make you feel inflamed. It does make you feel like sort of that. I mean, it doesn't feel like it's sunburn, but it gives you sort of a little bit more of that edgy
Hmm.
acid reflux feel. It doesn't feel good going down, then we probably need to do some repair.
100%. So when we look at that, that's an important. We look at the underlying physiology. So I always say test it. Now, some people could have an ulcer. They could have blood
Mhm.
coming up. They could see blood
Yeah.
in their stool. Could be coughing up blood. If this is the situation, you definitely want to go to your MD to get some stuff ruled out. We want to make sure there's not a cancer or not, not going so anemic where there could be issues with massive anemia problems, a massive fatigue, or even just bleeding out. So we want to make sure if we're at an extreme level,
Yeah.
we want to make sure we're getting that ruled out. 9 times out of 10, you go see your MD, they're putting you on an acid blocker. And that may make sense if it's really acute. So we have like the continuum of like optimal health and like being the extreme winter, that end part, yeah, there may be a need for an acid blocker acutely, right? So
Mhm.
I'm not going to say no, but ideally, the problem is that acute recommendation becomes forever, becomes
Becomes chronic.
decades. And then now you have the kidney issues. Now you have massive mineral absorption problems. You're probably going to be
Liver.
on an ED medication in a few years because you're not breaking down your cholesterol optimally, which is the
Yep.
backbone of all your sex
Sex
hormones. You're
hormones.
not breaking down your zinc and selenium, so thyroid function and hormone function is going to be off. Maybe you're not breaking down cysteine and your sulfur
Mhm.
amino, so now glutathione gets low. So you can see when you start to screw up your digestion, you can see this collateral
Yeah.
damage that starts to spin off. It's like a flywheel.
Yeah, and just to like again emphasize on the importance of your digestion. I mean, that's the major way that our body rebuilds itself. That's a major way your immune system, your hormones, your immune system, right? Your digestive detox, all of these things are dependent on what's going on inside of your digestive system. So, a lot of people, I don't think a lot of people always make that connection. you know, but your digestive health is at least the one of the top things that you need to pay attention to. The only other thing that I'd say would be comparable would be brain health. Your brain and your gut; those are the top two things that really you need to make sure that you're dialing in things.
And they're intimately connected, right? A lot of
They're
the
connected. Yeah.
if you have gut permeability issues and you have leaky gut or gastrointestinal permeability, as you see it in the literature, you're probably going to have blood-brain barrier (BBB) permeability issues. And again, the astrocytes are what
Hmm.
control the blood-brain barrier. And if that becomes compromised, then the microglial cells in the brain, which are the immune cells in the brain, start to become more active, and that can create cognitive issues, brain fog. And they've done studies where they looked at, antidepressants compared to ibuprofen for depression.
Yeah.
And they've seen ibuprofen significantly reduce depression. Why? Because there's an inflammation component to brain health and to mood. That's why the newer generations of antidepressants coming out on the market in pipeline, they're not just SSRIs or tricyclics from the 80s or antipsychotics. They're going to be working on an anti-inflammatory
Yeah.
mechanism.
Yeah.
Now,
NSAIDs.
you leave it to big pharma, right? You go back to the COX-2 inhibitors of the early 2000s, Vioxx. I mean, that killed 60,000 people according to the FDA. So there's a price to pay when you start to monkey around with inhibiting enzymatic pathways and blocking different inflammatory pathways, because they found that COX enzyme, cyclooxygenase 2, COX2 enzyme,
Yep.
was very important for regenerating the gut lining in the heart. So when you blocked it, yeah, you decrease prostaglandin E2 and inflammation, but you also decrease gut lining and heart repair, right? And
Yeah.
vascular repair. And so you see, you got to be careful with the trade-off. And so
Right.
when we deal with inflammation in the functional medicine world, the first input we're going to deal with is diet. We're going to try to get the processed foods, the gluten, the inflammatory sugars and grains. We're going to get that up. We're going to increase nutrient density. We're going to get good fats, right? Good
Yep.
fish oil
Yep.
fats, EPA, DHA, good healthy grass-fed meats, GLA fats, egg yolks, good healthy animal fats, good healthy, non-oxidized plant fats, cold pressed
Mhm.
olive oil, cold pressed avocado oil. Maybe some chia seeds. You're going to
Yep.
get some more omega-6 on that side. But as long as you're balancing it out, you're going to be in good shape, because the fatty acids and inflammatory flours and grains and sugar are going to be the biggest thing that's going to drive inflammation out of the gates.
Yeah, and again, the fats, in and around your body, they're around every single cell that you have. They're on your myelin sheath. They make up your entire brain. So fats
Mm,
and the kind of fats that we are eating are super super important. I think I don't think they can be understated. The fats that we eat, because what we do in our generation, which is different than those of the past, we used to eat head to tail in cows, or like in the food that
yeah,
we would eat head to tail, and that included the fat. Right. What we do
of
now is
course.
we go to stores and we can choose what fat we want to buy. Some of those fats are actually that they're broken fats. They're a big issue for your body. Your body can't take them in, and your body, it creates inflammation within your body. Right. Some fats are good for you, but we now, because we're in a place now where we have to choose our fats, we've got to make sure which fats we're choosing. We know what we're choosing. Whereas back in the day, we would eat the whole animal. We're just automatically getting those fats, and it's a completely different
Correct.
situation. So, but those
100%.
those build up our cells, our brains, myelin sheath, and a lot of other things in our body.
Yeah, and the problem with vegan vegetarian, right? I'm going to be straight here out of the gate. There's two arguments. There's the animal cruelty argument. I get it. Factory farmed animals, right, in cages, not good.
Yeah.
I get it. I totally agree with that. We want to be choosing
Yeah.
healthy animals and just allow them to have one bad day. Like, that's the argument there. Number two, we want the least amount of deaths per nutrition, per nutrient, per calorie. And you can feed a family of four with one cow a year, right? And you look at any of the vegan processed foods, corn, grain, soy, any of that stuff. That combine that's going through is killing rabbits. It's killing moles. It's killing squirrels. It's
Yeah.
killing snakes. Right? There's all kinds of animals that are dying going through that combine.
Yeah.
And so that's a real thing that happens. And so there's always going to be death when it comes to eating food, because the idea is, for me to sustain life, I have to take a life at some level, whether it's a plant's life or an animal's life. There's always life
Bugs.
cycling,
Yeah,
right?
bugs, whatever. That's just
Bugs,
natural
the whole
cycle
nine
of life.
yards,
Yeah,
right? And then we're
totally.
just, we're just making a judgment claim saying, well, that animal looks cute and furry and has a mom and a dad, so that has more value than the bug, right? So we're making these judgment claims. But in general, it always takes life to sustain life, right? I think of that,
Yeah.
watching The Lion King last week. I let's think of the Elton John Circle of Life song in the background, right?
Yeah.
And it's true, though. It's true. So that's a real thing. So I get patients to focus on okay, if that is a really important emotional piece to you, great. There always will be life taken when you eat food. The question is, how do we take the most life? Sorry, how do we take the least
The
life
least
and
life.
get the
Yep.
most amount of nutrition coming
Yep.
back on the backside? So that's kind of my argument there. The next thing would be just nutritionally, right? The fatty acids that you get are just amazing. Like you get shorter chain fatty acids on the omega-3 side. So with flaxseed, right? You get alpha linolenic fatty acids
Mhm.
that are an 18 carbon fatty acid on the omega-3. And that gets converted to EPA on the 20 side and then 22 docosahexaenoic acid. So you have this delta 5, delta 6 desaturase enzyme. That enzyme is like maybe only converts like 5-10%. And if you're
Mhm.
insulin resistant or inflamed, you get way less conversion. And so you don't get a lot of conversion of these good anti inflammatory fats with vegetable fatty acid sources. Two, they're just
Mhm.
more prone to oxidation. And so, good
Yep.
healthy fish oil, as long as it's coming from wild caught fish, smaller the better. And of course, storing them in a way where it's not going to oxidize. Maybe adding some vitamin E or rosemary to it. The good brands are going to make sure it's not oxidized. You're going to be in a better place out of the gate. So, good fatty acids. You're getting good proteins and fats without all the extra carbs. Most vegetarian protein sources, unless it's a pea protein or something that's in a powder form, which again, it's not natural, comes with about 4 to 5 times more carbs than protein. And so if you need 100 grams of protein, right, a day, you're probably getting 400 to 500 grams of carbs, unless you're overly relying on pea or rice or hemp protein, which in itself isn't really that natural if that's where most of your protein comes from.
Yeah, and I just want to hit on that oxidation a little bit as well because we're talking about acid reflux. So there are various different foods gives us inflammation, right? So there's the breads or what I call the whites, right? The breads, the crackers, the all the gluten kind of filled things. Sometimes people can get it with rice, but you can also get it from oils, right? So you can still get it from oxidated oils. Oxidated oils are going to create what's a word for it is free radicals or reactive oxygen
Yep.
species, right? It means it's going to damage your cells. They are going to damage your cells. If you are intaking oxidative fats, you're going to get cellular damage. That's going to happen.
100%. 100%. And then I'm going to totally contradict myself, kind of going back to inflammation. Sometimes animal protein and more fats can actually cause more acid reflux and more of that upper left
Yep.
quadrant pain. Why? Those foods are more expensive on the body to digest. They require more
Mhm.
enzymes and more acids. And
Power.
this is why many people switch to vegetarian diets, because the animal protein is a sign that your acid and enzyme pathways are not working properly. And so then
Yep.
they go and say, oh, well, it means the animal protein's bad. And they go to eat more lentils or eat more chickpeas or whatever. Okay, fine. But it's a sign that your enzymes and your acids are not at
Yep.
optimal levels. And that's the reason why you're having problems.
Yeah, and that actually brings up a
Mhm.
really good point too. Is that having somebody with you, a practitioner, a coach, right? They can walk you through this stuff. That's what they're looking for, right? It's a lot of times we can think, oh, I'm just going to go straight up on keto. Well, you might have issues with keto, and you might not know why you're having issues with keto, right?
Yes.
Then you're gonna say, well, I'm going to go paleo, and you might have issues there, and you're like, I don't know why I'm having issues because somebody else told me to go paleo, right? So again, like we said yesterday in yesterday's conversation, we're looking for why are certain things happening? Why is your body presenting in a certain way? And then we make adjustments. And some of those adjustments are
Bingo.
on the fly, right? Because you'll see somebody a first time, and then it's like, here's what the protocol you need to start at. But then something changes, something physiologically, and it's not uncommon to say, hey, I want you to draw back something, or I want you to add something depending on what's going on.
Yeah. And many people, they actually do better on a vegan vegetarian diet because of the healthy user bias. Once you start trying to be vegan vegetarian, you end up drinking more water, drinking less alcohol, not smoking, eating less processed foods. Maybe you focus on getting, some healthier fats. Maybe you're trying to use olive oil in your dressings now. So there's a lot of things that naturally go by the wayside that's in the
Mhm.
processed food camp when you
Yep.
start to be more vegan vegetarian. That can happen, but that's the healthy user bias. And I say, okay, well, just now try to do some of the healthy things while adding in a little bit of healthy protein here or there, do it slowly, and then maybe add in some GI support along with it. And that tends to fret those things out.
Yeah. And everybody's body is different, right? So some people can handle more, some people can't.
But if they
So,
can't, why? Right?
yeah,
Because
exactly.
in the end, like right, thousands of years ago, if you were in any climate in the northern hemisphere, you just didn't eat without refrigeration and all that. You just didn't. You only had meat in the winter months. Vegetables
Pretty
wouldn't
much.
last. I mean, okay, maybe you can pickle some things, but you had to rely on meat or hunting, going out and hunting and taking down a deer, taking down some kind of a buffalo, and then relying on that from the winter because you just
Yep.
couldn't have it. Or if you let's say your wheat and corn got moldy. I mean, you were done. Like,
You're done.
you needed to have that, animal protein during the winter months where you can go hunt.
Yeah. Well, and just like on the side of again, the acid reflux is, yeah, what you're putting in your mouth. Is it causing something to happen? Like, are you getting some kind of a sign or some kind of a symptom that's telling you, hey, the food that I'm eating, my body's not agreeing with? And I think what's happened is, as a society, we've sort of normalized acid reflux, right? Oh, everybody has
Totally.
acid reflux. We totally normalized it. It's not normal. That is your body's first mechanism of saying, hey, this, I'm not agreeing with this. This, you should not be eating this, right? But what happens is we continue to eat that, and then we keep on taking these PPIs, right, or these proton pump inhibitors. And then what Justin was talking about, we start shutting down these other pathways inside of our body, which then creates other symptoms because we're shutting down those, those mechanisms by taking the PPIs. For example, hydrochloric acid, right, in our gut, that's responsible for breaking down food or killing the parasites or the yeast or the bacterial overgrowth. Because you're on those PPIs, your hydrochloric acid is going down, and you're not able to, you're not able to digest properly. And eventually down the road, you're going to have those sex hormone issues like Justin talked about, because all sex hormones are made from fats. So it's just this process of cause and effect that's happening inside of our bodies. But it all starts, for a lot of people, it starts with acid reflux. That's kind of the starting
Correct.
mechanism. And because they've not normalized it, sorry, over the years, they've normalized it. Now we've got other issues that we're seeing.
100%. And then this may connect into hiatal hernia as well, because now that stomach is really inflamed, right? And now it's common when things are really inflamed and tight, it's possible that stomach could contract and kind of start to, here's the diaphragm, here's the stomach, it can start to move above the diaphragm. And that's a hiatal hernia. But, going in and surgically tightening up the diaphragm muscle around where the esophagus is probably is not the root underlying issue. It's going to be getting the inflammation down so that muscle isn't so contracted and moving upward. And so
Mm.
you can pull it down. There's different manipulative techniques where you can breathe in, and then as you breathe out, you pull it down. But you got to get the inflammation down. And so, of course, what are the big foods, right? Your processed flours, your grains, your dairy. Of course, sometimes raw foods. Sometimes raw foods can be really rough if that gut lining's already
Yeah.
there. Sometimes foods that are more acidic, sometimes coffee, sometimes
Spicy.
citrus could already be, yeah, spicy foods. Sometimes a lot of fat too, because a lot of times when there's low stomach acid, there's also low bile. And
Hmm.
sometimes you have to go a little bit maybe lower on the fat until you get your enzymes fixed, till you get your acid fixed, till you get your bile fixed, and then we can gently ramp it up. And we may have to cook things and avoid a lot of raw things out of the gate. And there may even be some FODMAP sensitivity, because there could be bacterial overgrowth in the small intestine, in the stomach. You could see H. pylori, of course, in there. And H. pylori loves to lower stomach acid. It produces an enzyme called urease, which hits the urea protein, spits out CO2 and ammonia. So when you run a urea breath test, you're measuring for positive CO2. Once you swallow the urea, blow in the tube, we're looking for the increase in CO2. It also spits off a bunch of ammonia, which then is a 11 on the pH scale, which then
Yeah.
raises your pH and lowers your stomach acid. So that can be a thing too. You could be SIBO, bacterial overgrowth from the small intestine, and even a little bit in the gut. And you could see that on the lactulose or even a glucose breath test. And then, of course, just SIBO in general. There could be
Hmm.
elevated Citrobacter, Klebsiella, um, Proteus, Morganella, right?
Yeah.
These are all going to be big bacteria things. It could be CFO,
Yeah.
small intestinal
Yeah.
fungal overgrowth, right? Candida overgrowth, Rhodotorula, Crucei, albicans. And then, like I mentioned, your small intestinal bacterial overgrowth too. These are all big things that need to be looked at, and doing a really good test can be helpful. But you can see this atrophic gastritis. You can see this silent reflux, especially if you lay down at night. This food could sit in your stomach a lot, and it could hit your throat. And so sometimes being on a wedge pillow or putting some risers on the back of your bed to kind of create a little incline, or waiting 3 or 4 hours before eating your dinner, maybe have it lighter, can be helpful. And then
Mhm.
working on things to help the gut lining, to help that atrophic gastritis. And then if you have a hiatal hernia, just understand you got to get the inflammation down so that muscle can relax and chill out. And most of the time, you'll find that you'll be able to avoid surgery if you get that inflammation better. Because most people, they notice the hiatal hernia gets better when their diet gets better. It
Yeah.
very rarely correlates with good diet, it gets worse. Usually it's bad diet, it gets worse. And so there's that correlation there.
Yeah, and then you have, of course, the leaky gut issues that happen as well. So it's like, you know, we're
Yes.
we're really looking all over the body at this point. So if you've had acid reflux for a long time, it's likely there's downstream issues, and the epithelial cells, the tight junctions have loosened up. What that means is basically, uh, you know, all of these different antigens, biotoxins, neurotoxins, you name it, can get into the bloodstream. Right? Once they're into the bloodstream, it can create all kinds of issues. That's why a lot of, in a functional medicine perspective, when somebody has a skin rash, right? You got a skin rash, you have rash issues. Actually, one of the first places that we're actually looking at is the gut. We're not looking at the rash itself. And many of times that's the case of what we're looking at. We're almost always drawing back and saying, hey, what's going on inside of the gut? And do we have leaky gut going on? Because if we do, then that means any of your symptoms that you have going on, just about any metabolic symptom, can be drawn back to the gut in many cases.
100%. Can you go more into detail on the leaky gut component with this whole thing?
So leaky gut, small intestine, where your body's responsible for absorbing your nutrients and
Yeah.
and the food that you're eating. But you also, along with your food comes parasites, comes yeast, comes mold,
Hmm.
right? Comes
Hmm.
all these other aspects,
Yeah.
right? And so in a perfect scenario, those don't come along. You're just digesting your food and it all gets to the cell and everybody's happy, right? But what happens is the epithelial cell over time, right? If over time is it starts to build up and there's a mucosal area, or not mucosal, but I'm trying to
Barrier.
think of the word, barrier, right?
Yep.
And on top of that, you can have overgrowth of things that get caught there, right? So you can
Yep.
have mold, you can have bacteria, you can have
Yep.
parasites that get stuck in that area. And the mold, for example, will shoot out mycotoxins, and that eventually starts to delineate this tight junction right inside of
Yep.
your body, um, and it gives exposure because what's underneath your epithelial layer cells is your bloodstream. Your immune system is
Yep.
there too, but under your immune system is your bloodstream. So once they make it past that, number one, you have some immunocompromised issues, but number two, you have things going inside of your bloodstream, and getting into your body wherever your weak spots are is where it's going to take advantage.
That makes sense. And so essentially, we have our immune system being exposed to all these different, either food particulate, could be colonized mold, a bacterial overgrowth, fungal overgrowth, a lot of these endotoxins. And that's allowing these things to get into the bloodstream. It's causing the immune system to get stressed out because now these
Mhm.
things shouldn't be at that high level. So it's creating immune stress. And though it's easy to have fatigue, it's easy to have maybe now more food allergens. This is how, the major kind of proposed mechanism of autoimmunity starts. It starts with some level of gut permeability,
Yep.
some of these surface proteins getting tagged by the immune system, and then seeing similarity to other, whether it's gangliosides or myelin in MS, or
Mhm.
the thyroid in Hashimoto's, or the beta cells of the pancreas in type 1 diabetes, etc. So this mechanism is so important, and it's going to really drive almost all major autoimmune conditions in the body, according to Alessio Fasano over at Harvard. So this is the data that's out. And again, gut permeability or leaky gut, this has been a really controversial fringe topic for a decade or two. And it's not really a disease. It's kind of more of an underlying mechanism that opens the
Mechanism,
door
yeah.
for other things. And so conventional medicine has a hard time labeling things that aren't a end disease, right? It's kind
Right.
of more of a passageway for a lot of other things. And so it's hard for conventional medicine to label things that are more preemptive, that are more gateway kind of components. They're
Mhm.
more looking at things in an end stage, and then they like to categorize that end stage disease. And
Yep.
so this is why it's really hard to be accepted. Now, there's some conventional medical things coming out that look at decreasing the protein zonulin that causes the guts
Tightens
to
it, opens
open,
up.
the enterocytes to open. But with any drug, there's going to be some kind of a side effect. And so we
Yep.
know there's natural things that decrease zonulin. Guess what? Getting rid
Yep.
of gluten, getting rid of process, getting rid
Yep.
of the endotoxins and the bad bacteria, getting rid of
Yeah.
casein, right? Breaking your foods down better, not having these bigger globule kind of proteins and things. So there's all kinds of natural things. Vitamin D, glutathione
Yeah.
lowers zonulin. So it's a lot of other natural things. And so the way I look at it is, if you lower zonulin synthetically with a drug, but you don't fix the real underlying cause of
Yeah.
why it's high to begin with, are you really fixing the problem? Because more than
Well,
likely it'll be like Vioxx with the COX2 enzyme inhibitor causing side effects down the road
yeah.
there. So you got to be careful with that.
Yeah, well, and Zonulin has a job, like, it's not the bad guy, right? And that's the problem sometimes with, traditional conventional medicine. It's like, well, let's shut down Zonulin before we ask what Zonulin does. And one of the things that Zonulin does is it opens up and closes those tight junctions, but it actually has the means to do it on purpose. And why would Zonulin want to open up like that gut barrier on purpose? Well, if there's infiltration into the immune system gets triggered and it triggers Zonulin, which opens that back up so that it can push this stuff back out. In other words, so that it can push out the trash. The problem that happens over time is that when it gets infiltrated consistently, zonulin is always there. It's always open. So now you get this free flow back and forth happening, right? So if we shut
Yes.
down zonulin, you're shutting down the ability to take out the trash in your immune system underneath that epithelial cell layer.
Correct. And even before that, I had Dr. Tom O'Brien earlier in the year in my podcast, and we
Yeah,
talked
I
about
remember.
this, talked about leaky gut. And he said, really, it starts off with the toll-like receptors. Toll-like
Yeah.
receptors are like the centurion guard that sit in your intestinal tract. And essentially, when microbes, whether it's dysbiosis or bad foods come in, they're going to trigger. They're going to trigger an immune response. They're going to
Mhm.
activate an anti-inflammatory response to counter that damage. And so, whether it's LPS or gluten or other things, that's what starts the interleukins and the cytokines and the TNF alpha and the nuclear factor kappa beta, all these different immune kind of cellular responses. That's what starts it. And then as a result of that, that's where the
Mhm.
tight junctions may start to become more permeable and unzip and open up. And so it's like food, bacteria, microbes, imbalances, stress, right? Cortisol, because there's some data on just having head trauma or doing even like long distance marathon training can actually increase gut permeability, right? Any kinds of these stressors, toll-like receptors of the centurion guard, they start to call in all these inflammatory messengers. And then
Yep.
we start to see the zonulin go up. And then we start to see the gut lining start to unzip a little bit regarding the enterocytes and the tight junctions.
Yeah, and that was a really great podcast. I actually listened to that, and so leaky gut really affects the whole body. So even though there's back and forth, it affects the whole body. Once it gets into the bloodstream, and that was one of the things that he talked about, right? Is that it's going to go after the weak links, the weak links inside of your body. So whether or not it's going to be a skin issue, a joint issue, a thyroid issue, a colon issue, adrenals, your brain, whatever it's going to be, depends on where the weak links are within your body.
Yeah, exactly. Good study here. Toll-like receptor regulators of the immune response in the human gut. Pretty cool.
Yeah, I haven't seen
So,
that. Hmm.
toll-like receptors are powerful molecular regulators by which the immune system may sense the environment and protect the host from pathogens, endogenous threats. And so, essentially, let's see here. TLR is crucial for the development and discovery of compounds are useful to maintaining and reestablishing homeostasis in the gastrointestinal tract and regulating inflammatory response.
Hmm.
And so right here, whether it's non-bacterial ligands, non-bacterial compounds, so it's really that centurion guard guarding the immune system.
Yeah.
Right here, the immune system contributes to the maintenance of delicate balance between bacteria, yeast, bacteriophages, optimal health. So really, really important. So here's a good one right here. So you have the environmental gut lumen, right? And then you have all these different immune markers here, macrophages, and then we have the gut permeability happening here.
Yeah. And
So we
just to
start to have
explain
see
that,
these. This is the
just
gut
to
epithelium here. Start to open up.
And then just to explain that just a little bit, so that's the tube. Do you want to just explain that to people that are listening,
Yeah, I
like
mean,
what they're
so
looking
over
at?
here, over here you see these are healthy subjects, right? This is your immune cells. These are your irritable bowel disease patients. What you're starting to see here is these gaps here
Hmm.
start to open up, and so then you start to have more of these microbes here. This is in the
Yep.
intestine. Go
Yep.
from here in the intestine into the bloodstream, and then these macrophages start to tag it, and they call it an antigen presenting cell.
Yep.
And then when it tags it, it starts to make antibodies to it. And then this is where you start to get either increased immune stress. It could be things like allergies and brain fog, or it could be autoimmune conditions starting.
Yeah. There's also literature, as we talked about earlier, eating your food properly, because if there's too big of particles that come in here,
Yes.
your immune system can also tag those and mistag them. And if they mistag them, like Justin said, they're going to actually communicate that that's actually they're going to go after that in your body.
Yep. 100%. So good stuff here. I mean, it's good that we talk about it holistically and, show information that this is mainstream data. The problem is, your average medical doctor in medical school is 20 years behind time.
Yeah.
And unless there's a drug or a treatment modality to address it, then it's just kind of like, all right, it's nice to know, right? And that's
Yeah.
where we're at. And conventional medicine's kind of made a decision, probably 100 years ago. We can go into the history of that using supplements and nutrients and diet changes is probably not going to be the direction they want to go in, right? It's patentable pharmaceutical drugs and surgeries, which have an amazing place, 10-20% of the time. And even these conditions like acid reflux, gastritis, acutely, it may make sense to give someone an acid blocker if they're having a big flare, get them stabilized, get them to someone
Mhm.
like me or you,
Yep.
get their diet changed, get their gut tested, see what's going on, and then slowly work with that doctor and gently nudge that down. as we
Yeah.
get some stability and work on healing it. So there's a place for everything, right? We
Yeah.
just don't want to look at this band-aid and think that this is the long-term approach forever. That's all.
No, and it's more of a constellation approach, right? Like there's so many things affecting different things inside of your body, and the order in which your body works from an A and P perspective is super important when trying to deal with these things. You're trying to solve things that's happened from a chronic perspective, and those are the kinds of people that you and I see every day. Chronic is the key, right? It's nobody's coming to us because, oh, I got hurt yesterday, I need help today, right? It's people that have chronically, your biochemistry has changed, things have happened downstream from that, and oftentimes what we can do and what conventional medicine will do is says, aha, now I see a symptom over here, right? And so that they sort of treat that almost as if it's acute. Let's stop this particular thing from happening, but it's probably something that's been happening for years and years and years. And one of the it's not a smoking gun, but it's one of the pieces again that we always go back and look to. How is your gut health? What does your gut
Mhm.
look like? How long has your gut been that way? Oh, it's been that way for 20 years. Okay. And you have a bunch of rashes and you haven't been able to get rid of these rashes, and you got eczema, and you got joint pain, and you also have blurred vision, right? You've got, you're pre-diabetic, you're diabetic, right? We start looking and taking these things down and looking them from an A&P perspective. And the gut is a super, super, super important place to look.
100%. Now, someone asked in the chat here, well, what about LPR, which is laryngopharyngeal reflex? Laryngopharyngeal reflex. It's just basically you have acid reflux, right? You have GERD, and there's two types. There's going to be heartburn, which is going to be more pain and inflammation in the lower part of your esophagus, and there's going to be LPR, which is going to be more of the reflux going into the vocal cords. You may taste it, you may feel it in your mouth and actually taste it. It could just be in your throat, and you just get hoarseness and more throat irritation, more in the vocal box. And so heartburn, not really impacting throat and sound and taste, probably more just
Yeah.
your GERD heartburn type. And then LPR, it's just going higher up. And with LPR, a lot of times there's gastroparesis, and you may see it when you lay down at night, or if you've gone 2-3 hours with eating and that food's still in your stomach, and then you go horizontal, it can come up. And so
Yeah.
the easiest thing with LPR out of the gate is you need to support motility.
Yeah.
So you need to make sure that food is emptying your stomach. And so that's where we would make sure the diet's solid. So we may add in some bitters. We may even sleep on a 8 to 10 inch pillow wedge just to keep everything moving downward, so we have gravity to aid in the emptying. And we can also be using things like ginger tea and make sure we're not eating a big meal with a lot of fat and protein inside of 4 hours before bed. Those can all be good things to do. But you got to look at the H. pylori, and you may or may not be able to handle stomach acid. And that's where you got to work with a good functional medicine
Yeah.
provider. I gave you the 1 teaspoon of vinegar or lemon juice kind of tester. Start with that.
Home
And if
remedy.
that causes pain or inflammation, then acid's not for you right now. And that's where you got to work with a good functional medicine person and work with bitters and work with enzymes, maybe even some bile stuff, and make sure you get the timing before bed dialed in. And you may want to get a 8 to 10 inch pillow wedge just to be on the safe side with that too.
Yeah, absolutely. Yeah, it's putting all these little pieces together, both from a diet and lifestyle perspective, as well as herbal remedies and other opportunities that there are. But basically, getting your body to function again and to be able to heal itself again, right?
Yeah.
And this always comes down to stressors at the end of the day, right? Whether it's
Yeah.
physical, chemical, or emotional. We talked about that the other day from a broad spectrum. Emotional stress can cause all of
Yeah.
this to happen as well. I
Yep.
mean, ulcers have always been tied to high levels of stress that somebody has throughout their life, and it's not
And,
uncommon to get ulcers.
And then
So,
why? And then why, right? It's because when
mhm,
you're under a lot of stress, cortisol will thin out the gut lining. It'll lower IgA levels.
yep,
It creates a sympathetic nervous system response, which causes digestive juices to go to the extremities to run, fight, and flee, and
yeah,
which then decreases the acid, decreases the enzyme, and decreases the digestive juices. Remember that parasympathetic nervous system response is important for digestion, right?
right,
That's the rest and digest. And why someone gets LPR versus GERD versus ulcerative colitis versus Crohn's, everyone's going to have a genetic predisposition,
genetic,
right?
yep,
We all break down. If here's our genetic chain, and I pull it weak and I pull it
yeah,
tight, right? Why does some people break at chain 20 and some at 40? Right? It's
yeah,
just
it's
everyone
genetic,
has a little bit genetic weakness in that chain,
yeah,
and we don't know where it's going to break until you pull it tight. And you can obviously use family
yeah,
history to kind of see that, right? And so everyone has that weakness. The focus shouldn't be on, well, why did chain 20 break versus 40? It's like, let's just stop pulling the chain. Let's like take the pressure off the
yeah,
chain.
yeah,
We don't need
yeah,
to focus on why that
yeah,
chain, just to stop the pressure on it.
yeah. Let's see what happens whenever we actually position it to have success. right? So that's our whole
Exactly.
goal. Underlying ideal of what Justin and I do is that your body knows how to naturally heal itself. It's just that
Bingo.
there are things in the way. There are things in the way. There are mechanisms in the way. It might be drugs in the way. It might be, things that you're eating. It might be things that you're doing. Right? There's various different things that it could be. But again, like Justin said, you need somebody who knows what they're doing, who knows the order that this AMP works.
Yep.
And how do we unpeel this onion? And that takes time, by the way, guys. If you're looking to come to a functional medicine practitioner that's a good one, and you've ruined your body for 20, 30 years, and you think you're going to come in and fix yourself in 30 days for $30, right? That's that's not going to happen, because that
Mhm.
just isn't. One of the things that I will oftentimes tell my clients, I said, do you think that this is a $300 problem? Right. And it's like, if you have chronic issues that are messing with your life, that are taking your life away from you, particularly in the gut. I mean, I talked to somebody the other day that had IBS, and she's chained to the bathroom, like that. She
Yeah, I mean,
can't do anything.
it's like having
Right.
a leaky pipe in your house, right? If you don't fix that, the pipe gets more leaky over time, and it creates more damage and more mold, which becomes more costly, right? And so anytime you fix something, it gets more. If you don't fix it, it gets more expensive, and there's also more symptoms, right? And so I
Yeah.
always tell patients, we try to provide a ton of free information. Start with some of the free stuff that we're chatting
Yeah.
about. Start with
Yeah.
some of we're trying to give you the AMP, the anatomy and physiology, and the biochem about what's happening, so you're educated, right? We want you to be
Yeah.
more educated than your average MD, because they're going to
Absolutely.
look at you, they'll hear your symptoms out, they're going to do a great job ruling out maybe a cancer or a bleeding ulcer. That's great.
Yeah.
They're going to do their job, but 99 times out of 100, you will not fit into that camp anyway. And so you'll be given an acid blocker and maybe a medication to control any symptoms, and that'll be it. And maybe that way for decades. And
Yeah.
I see it time and time again. I've been in the trenches for 15 years, 5,000 plus patients. So when you see the pattern, it's like, okay, this is just, on repeat. So we want to make sure our patients are educated, asking good questions. So if you guys want to
Yeah.
dive in, you guys can reach out to Rob at heritagehealth.life. We'll put Rob's link down below. Reach out to Rob. He sees patients worldwide. And myself, Dr. J, justinhealth.com. You want to reach out. We practice what we preach, and we utilize all of the techniques and all of the AMP, anatomy and physiology, that we're talking about to work on getting our patients better. So feel free, utilize those resources. Rob, anything else?
I think just the last little thing there is with the IBS, right? Like, that's a downstream effect of what she knew was happening 20 years earlier. Right? She
Right.
had acid reflux 20 years earlier. She just normalized the symptoms. So that's the other piece that I would say to people: don't normalize chronic symptoms. You shouldn't have chronic symptoms day after day after day. If you do, then later on, we don't know what's going to happen. We don't have a crystal ball. For her, it's IBS. For some people, it's cancer. For some people, it's something else, right? It's autoimmune. So I just want to say, don't normalize your symptoms. If they're chronic and you're getting them day after day after day, you need to see somebody.
Plus, when you're dealing with chronic issues, you go see your MD. They're going to say, let's work on managing the symptoms.
Yeah.
You know how they don't say, let's work on fixing the root cause of the symptoms. Well, if you
No.
manage it, it just means more drugs, higher doses, potentially more side effects. And like we talked about, right? If you do the acid blocker, we know that now is associated with kidney problems. And that we also know that may impact our mineral absorption. So maybe now for a female, now we have bone density issues. And then now maybe we have ED if you're a guy, because you're not breaking down your cholesterol, and
Yeah.
then you're not breaking down your protein. Maybe now you're on an SSRI. So you can see how these things start to
They
spiral. And
just,
when you start to do the management thing, you just start managing one symptom after the next, and then a side effect kicks in, and it just kind of gets
mhm.
worse over time. So that makes sense acutely, right? We don't want to throw MDs under the bus too bad, because they
No,
play a really important role in society
absolutely.
and helping patients. It's just we don't want to get stuck with the acute treatment being now the chronic care. It's really
Yeah,
important. We want to draw that
absolutely.
line between the two. We all
Yep.
have good roles to play. So hope that helps. And I want to see your comments down below. Let me know what you guys think. I want to know your thoughts on it. If you want different video topics, or you want us to expand on some of the things that we're hitting, you're like, oh, that's cool.
Yeah.
I want to see it down
Yeah.
below.
Yeah, maybe if you've had acid reflux, just put in the comments how
What's
many
worked?
years have you had it? You're like, what's worked, right? Let us
Yeah.
know.
Yeah, I mean, having done this so long, the biggest thing is I try things. I ask patients. I say, "Well, what's working for you? What's this?" And you learn so much with patients. I mean, you learn interacting with a patient more than you do putting your head in some PubMed article, right?
Yeah.
Ideally, you kind of get the things that work, and then you go to PubMed and you say, "Hey, by the way, I tried this, and is there any data on this herb or this
Yeah.
nutrient or this biofilm buster?" Oh, okay, there is. That's cool. And so
Yeah.
you try to have that circle kind of come, full circle, if you will.
Yeah. I mean, it's science.
Yeah,
It's not a
it's yeah.
PubMed, but that's how science works.
Well, everything starts clinically first, and then that becomes the basis to form a hypothesis, and then the
Yeah.
hypothesis becomes future studies, right? That's how it
Yeah.
always comes full circle. So I appreciate it. All right, Rob, have a good day, man. Nice chatting with you. Everyone at home,